we talked about Calibrate V and what a great company it is. When you look at the board of directors, you look at the technology, you look at the industry, it's a no-brainer. If you're not involved with Calibrate V, it's because you really don't want to make money investing nowadays. But understand something, Calibrate V is the beginning. As we built this company, as Calvin and his team built this company, as the scientific teams worked to get this technology perfected, technology itself changed. Enter blockchain technology. Understand one thing. 10 years ago, blockchain technology was a misnomer. Nobody knew what it was. Nobody knew it was coming. Now it's anticipated that blockchain technology will be the main business avenue of the internet within the next 5 years for 90% of all companies doing business on the internet. And I know it's going to happen because I'm watching it happen. You see, blockchain technology changes the security level, it changes the ease of doing business, and it lowers the cost of doing business by getting rid of unneeded third parties. Everybody's going to use it. But it was tailor-made. It was perfected exactly for medicine. The privacy required in medical data transfers in the United States is extreme. The cost of missteps is incredible. For one breach of privacy of a patient's confidentiality can cost the physician, the hospital, the medical enterprise $1 million per episode. So understand something, they protect their privacy. The medical enterprises all own master patient indexes. A master patient index is exactly that, an index of their patients. They're walled and secured and protected. But that data needs to be transferred every minute of every day across enterprises because of the patient's needs. And that's been a problem that has plagued medicine for decades, protecting the privacy, but yet making sure there's good care. Enter the Calibrate blockchain. The Calibrate blockchain, designed by the medical professionals who have experienced the cost of this protection and these necessities, is incredible. The Calibrate blockchain, the missing link that is essential to every health transaction, universal patient index. It binds patient identity across health information transactions. There's zero tolerance in blockchain for error or unauthorized intrusion. There's efficient transfer of health information with improved medical outcomes. It's interoperable among health information systems, and the patient controls the access to the information. It's a huge, huge benefit to medicine. The benefits keep improving. Patient-controlled access to the info, and here's what I like the most. Monetized through cryptocurrency. Monetization of this information. Patient engagement. Let me explain to you why this is so important to medicine today. 10 years ago, or 11 years ago, the United States enacted the Affordable Care Act. It's lovingly known globally as Obamacare. When Obamacare was instituted, one of the things that the United States government wanted and still insists upon is the electronic recording of health records of every American. Medicare and Medicaid eventually pay for in excess of 90% of U.S. citizens in some health episode or another. They are the number one insurer in the United States. What they required is that every health enterprise, every medical enterprise, every physician, every clinic would help to engage the patients in electronically recording their own health records. Because we own our own health records, they couldn't do it without us. Since that time, they've spent in excess of $17 billion, and they failed miserably. Miserably. Companies like Mercer and GE have spent billions of dollars building portals and enticing hospitals to entice their patients to engage in those portals. The reason is this. What Medicare did to incentivize this, only a government can incentivize in this way. They looked at the fee structure and they said, what we're going to do is for every service you provide a patient, for every procedure you provide, we're going to lower the fees. that we pay you. And there's nothing you can do about it. But what we will do is we'll give you an incentive to get those fees back up, and that is engage those patients in electronic health recording. And that started 10 years ago, the hub of electronic health recording. There's giant billion-dollar companies doing electronic health recording. The difficulty is you cannot get or force your patients to engage. Now, when you do, you receive health engagement credits from Medicare, and those health credits combine to increase the value of all your procedures. So they really, really want it. It's worth billions of dollars. Well, the Calibrate blockchain answers that question specifically. Medicare has stated that if one or more physicians or healthcare enterprises upload the information to any portal and any of their patients ever engage, everybody gets the credits for that engagement. It's a huge, huge boom. Calvin Weiss is a genius. Understand something. Calvin Weiss is the chief financial officer of the Adventist Health System. As the director of Wellstar Labs, he has spent decades trying to solve this problem and living within that problem. What he has done with his team of scientists, which his team of MIT PhDs, is built the perfect portal which answers the question 100%. So here's what happens. Because of blockchain technology, the discoverability of the identity of the patient is zero. They're virtually undiscoverable. The data can be electronically recorded and the patient's identity concealed unless the patient were to use a master key or one of his physicians or authorized personnel use that master key. It solves the problem. The information is updated. It brings the patient into engagement through vitamins, minerals, supplements, healthcare, a lot of other cross ventures on the blockchain. But more importantly, it brings healthcare into engagement. It's a $400 billion annual business, and the Calibrate blockchain is specifically the only answer to the problem that was built by medicine for medicine to handle medicine's biggest problem. It's a no-brainer. Actually, it has become critically accepted in the U.S. business community right now that at the launch of this ICO, which is anticipated in August, there will not be enough Calibrate coins on the Calibrate blockchain to conduct the business that's already committed to the Calibrate blockchain. Most people would think that a problem. I think it's incredibly great. It's a great opportunity. This is a crypto coin that is not only going to rise significant and rise rapidly, but it's going to rise steadily because of the business model on the Calibrate blockchain. The SEC, the Securities and Exchange Commission, registers blockchains. This is the first Securities and Exchange Commission registered blockchain launching. This is the first secured cryptocurrency in the history of the world. Understand what that means to you as an investor. If you've invested in cryptocurrencies or blockchains, you know that every initial coin offering, every blockchain launch has been done minus the United States market. The United States market is a $22 trillion market. It is the largest market on the planet. It is larger than all other economies combined. And it hasn't been involved in any of them. What do you think is going to happen when the rest of the world and the United States market get involved in an opportunity like this? My conclusion is going to be huge. And I'll give you an example of what you can expect. Many of you have seen the cryptocurrency volatility up and down around the world, and you've seen a lot of people make a lot of money. But if you've been astute enough, you've looked at the ones that have a legitimate business model. Ethereum. Ethereum right now writes contracts for blockchain transactions. They write them for themselves and they write them for others. Ethereum has a crypto coin that's called the Ether. In January 2016, if I would have asked you to look at the Ether coin, it was selling for 97 cents. 97 cents. Today it's selling for $752 US dollars. That's an 88,000% return on a cryptocurrency on a blockchain that has a decent and profitable business model, and it's running without the benefit of the United States economy, a $22 trillion economy. It's running without the investments of the largest economy on the planet. At an 88,000% return, I don't think you would care. You'd be happy. But understand something. If they were involved in the U.S. economy also, they would be much, much higher today. What I expect to happen with the Calibrate coin is simply this. Our business model is significantly more valuable than the Ethereum business model. The people involved are the highest rated, most renowned scientists, physicians, and medical business people on the planet. And the requirement of the United States government that they all engage in healthcare reporting tells me that this is a big, big deal. The one thing that guarantees me an explosion is simply this. The U.S. economy has been denied access to these ICOs from their birth. The U.S. investor has been denied access to these ICOs from their inception. For the first time in history, the United States investor is going to be allowed to invest in an ICO. For the first time in history, the SEC, the Securities Exchange Commission, is sanctioning an ICO. If you own a Calibrate coin, you're going to look back 2 years from now, and you're going to look at the same growth, in my opinion, that Ether has had, or more. I would be insane if I were to call you or email you or talk to you person to person and say, look, get involved today. I think you're going to make 100,000% return in the next year. You'd have to look at me sideways. I'll tell you something. In January 2016, there were people buying an Ether coin. They didn't know they were going to make 80 or 90,000%. They knew they were going to make a lot of money. So happened they made close to 90,000%. I'm telling you, I don't know how much we're going to make, but we're going to make a lot. And what I want to suggest to you is this. We have an opportunity right now, as the technology changes and these paradigm shifts take place, to look at it and remember it. And we'll be talking about it to our grandchildren about how things used to be. Or we can take advantage of it. We can make a fortune so our grandchildren will be thanking us.